Hello, good afternoon, everyone. Good afternoon, everyone, to our departmental webinar organized by Department of Forensic Medicine and Toxicology. Today, our topic will be Virtopsy, and virtual alternative to our traditional autopsy. I am Dr. Shankar Subradeb Burma, tutor at Forensic Medicine and Toxicology. I will be the moderator of today's presentation. So, and further, if you have any
Coming? Am I audible? Am I audible? Thank you very much, Dr. Shankar.
Sorry, due to the technical difficulties. So again, good afternoon, everyone, dear sirs and madams. Today, our Department of Forensic Medicine and Toxicology has organized a webinar on the topic Virtopsy, virtual alternative to a traditional autopsy. I am Dr. Shankar Subradeb, tutor of Department of Forensic Medicine and Toxicology. I will be the moderator of today's presentation. So our today's topic, Virtopsy, an alternative to a traditional autopsy, will be presented by our assistant professor, sir, Dr. Devashish Ramadamu. So in case of any queries, dear sirs and madams, you can type in the queries in the Q&A box, which will be taken up in the end of the presentation. So without further ado, I'll request Dr. Devashish Ramadamu to begin with the presentation. Thank you.
Thank you very much, Dr. Shankar, for the introduction. Respected sirs and madams who are present in the today's webinar, I am Dr. Devashish Ramadamu, Assistant Professor, Department of Forensic Medicine and Toxicology. I would like to start with this sharing of my slides. As we have already, as the intro topic is already shared, the topic is Virtopsy, an alternative to traditional autopsy. I am Dr. Devashish, and my moderator is Dr. Shankar Subradeb Burma, tutor of Forensic Medicine and Toxicology Department, SMIMS. Virtopsy is derived from the term virtual and autopsy. Virtual is derived from the word virtus, which means useful, efficient, and good. We have to be careful regarding the interpretation of the term virtual. We might think that it might be the opposite of what is real. But here the virtual means does not mean that what is the opposite of real. It means useful, efficient, and good. It comes from the Latin word virtus. And autopsy is a combination of the classical term coming from Greek language, means autos, which means self, and opsomai means I will see. Actually, this term is coming from the Greek historian Herodotus. He used to travel to different places and he wanted to see things for himself. So he came with this term called autopsy, or by himself he wanted to see the places. So later on it was actually derived from that term. So autopsy means to see with one's own eyes. So by the merging the term virtual and autopsy, and by omitting the word auto, which is an aim to eliminate the subjective interpretation of the findings. And after that, a new term is created called Virtopsy. So the philosophical root of the word Virtopsy, it comes with a background. As I've already said, the autopsy is given by the Herodotus. He is also known as the father of history. Okay, so autos means self, opsomai means we'll look at. So later on, it was taken to forensic medicine. And then here we have new term called Virtopsy. Virtual, it's French, and virtualis, it is Latin, it means better, and opsomai means we'll see. So Virtopsy as such is defined as a procedure for postmortem investigation of dead body by the use of 3D optical scanner and photogrammetric surface scanning combined with computed tomography and magnetic resonance imaging. So Virtopsy was born from the desire to implement a new technique in radiology for the benefit of forensic science in the early 1990s. The computed tomography, here it is used as an imaging modality of the choice for two-dimensional and three-dimensional documentation. Photogrammetry based on 3D optical scanner at present is the standard of documentation of injuries in forensic medicine and is still used as a photography for regarding the exact measurements. Magnetic resonance imaging, or MRI, has had a great impact on the demonstrating soft tissue injury, organ trauma, and non-traumatic conditions. The state of blood vessels, organs, bones, tissues, pathological gas collections like air embolism, subcutaneous emphysema in trauma, hyperbaric trauma, decomposition effect, etc. is also shown. So to determine the cause of death and manner of death also is required. So Virtopsy helps in that. So to find out the crucial information and fine details regarding the body, which is difficult and at times it's very time consuming to acquire by usual conventional method, that is traditional autopsy. So its aim is to establish an observer independent and objective and reproducible forensic assessment method. So there is minimal invasive virtual autopsy technique where the body the body of evidence is not disturbed. Okay, so the conventional autopsy are often rejected by many family members, which is not tolerated by religions in multicultural society. So the non-invasive imaging documentation and by minimal invasive imaging guided sampling and angiography addresses the vascular questions. So the digitally acquired data, which can be reconsulted, and whenever new questions arise, or could be sent to a panel of experts for a second opinion. So Virtopsy provides an alternative means of acquiring relevant postmortem data for further research and are superior to old descriptive and photographic techniques in comprehensively demonstrating findings to the lay person who are in the court, and also help the judge and jury to understand some technical facts. So we have got a mobile machines which can be taken to the crime scene in case of mass casualties, sometimes aeroplane crashes, train accidents, natural disasters, for acquiring post-mortem data. So no forensic findings are ever disturbed, as they would be by a destructive techniques used in the traditional autopsy. So here I wanted to share this one short video how it is done. So this is coming from Virtopsy.com. So as it has been established in the University of Bern in Switzerland. So here CT scan MRI is there. So in the CT scan room, there is this CT scan machine and this the gantry where the body will be done. The CT scan will be done. At first, there will be photogrammetric assessment. So cameras photos will be taken from different directions. These green ones are the images and different points, reference point markers on the body, and these boxes are actually the camera positions. Okay, so when there is a surface scanning, after that a surface scanner is there which helps in scanning the body. So we'll see it in the details in later on. So here we have this robotic surface scanner. Which is scanning the body, and here for topographical coordinates of the body will be assessed by the machine, and quickly the auto surface scanners reproduces the exact body by merging the different images taken with very high precision, and it is matches the color of the body also. So after that, there will be a postmortem computer tomography scanning. So the body here in this case the mannequin is kept inside. Here the circular computer tomography is being done. Okay, so multiple images are taken and it will be merged with the photogrammetric scanning study. Sometimes angiography is also required in postmortem setting. So from the blood vessels in the femoral region, the contrast will be injected using a heart-lung machine sometimes. And then here we have the heart-lung machine. You can see it here. And then after that, CT scanning will be done. So angiography. It is actually invented by Dr. Richard Dinhofer from the University of Bern in Switzerland. This is the Vertangio. And another one is also there called Vertibot. With that, even the specimens for can be taken using the robotic techniques. Okay, so here in biopsy we have got this Vertibot. And in case if biopsy is required, a needle will be placed and from there the required material will be taken. Here you can see it from the heart, and diagnosis can be done through pathological examination. Here the lung findings are there, fat embolism is there. So likewise, all the data which is taken, okay, will be fed into a software, and then the real body reconstruction will be done digitally and can be and it's put in the autopsy table, a virtual autopsy table, where the whole process can be seen. Okay, so here the scan findings are put, and in this autopsy table digitally the images can be seen, observed, and a panel of experts can actually give their expert opinion. Here we can see one fracture is there without even touching the body, without even giving any kind of incision, directly by the use of autopsy technology. So as per the history, how it all began, how the Virtopsy began. It began with Professor Richard Dinhofer in the Institute of Forensic Medicine, Diagnostic Radiology and Neuroradiology, University of Bern in Switzerland. In the year 2005, he started this project called Virtopsy project. The University Medical Centers Institute of Diagnostic Radiology in Bern, Switzerland has already performed hundreds of autopsy as well as Virtopsy in the last 15 plus years, followed by comparison. So they have matched it and they have found it that it actually matches. Here you can see the Professor M.J. Thali or Michael J. Thali presenting the idea of Virtopsy in 6th International Congress in Baltic Medical Legal Associations. Okay, so he has given this concept, and then they have incorporated those photogrammetric documentation techniques which was established in the early 1990s. And here you can see how they have developed the 3D photogrammetric documents. Here a blunt force is applied over a skull, blunt force, and then skin, skull and brain model. Okay, so here we can see how the 3D based analysis is done and documentation by photogrammetry. So here we can see Professor Peter Vogt. He is famous radiologist from the same university, director of the Institute of Radiology, University of Bern, and then here Professor Peter Dinnerhofer. They are all involved in the Virtopsy project. He is from the Department of Radiology, Professor Vogt. So the documentation of a pattern injury on the skull model using 3D photogrammetric in this side. Here you can see the blunt force trauma. There is a fracture over the skull. You can see it in computed tomography. And here you can see it over the 3D photogrammetric area. So we have got this scale. This is coming from the Society of Forensic Odontology. Here you can see this round thing which has a cross in it. So if we have this kind of scale, we will be able to not only say the measurements, we can also tell the directions from this circle with a cross. So here we have got a first pattern injury 3D visualization, how it is merging into the body surface and internal radiological data set, and subsequent matching with the injury causing instruments. So autopsy to Virtopsy. Autopsy is oral description. Virtopsy is image. How is the value of evidence? So classically, you can say in classical procedures, what is there is that sectioning techniques are used, description is done using photographs and words, okay, and then autopsy, the expert observes by themselves and then they come to a conclusion called expert opinion. This is the process of classical examination. So here in Virtopsy, what is being done is it is an improved procedure where a scalpel is not used. There is no incision given in the body unless otherwise indicated in case of giving angiography. So the CT or MR scan, there will be an observation, okay, and then the pictures are also kept. Instead of protocols, there are pictures that needs to be followed, and the observation can be sent through telemedicine to different experts, and then the panel of experts will decide what will be the expert opinion. So improvement of the classical examination procedure by Virtopsy is seen, especially in terms of expert opinions. So you can see here also in the flow chart, you can see here there is an objective foundation. This is based how Virtopsy is based. There are findings and there are different display of findings, determination of findings, documentation and storage. All these are being done, okay, according to the best knowledge and conscience. Okay, but in traditional autopsy, what is being done is there is a subjective interpretation of the finding and there will be an opinion. So there is a difference. So how the findings are presented, not from tip to toe also, and also depends upon the skill of the autopsy surgeon or chief prosecutor, and also depends upon the postmortem changes. So the how, in case of traditional autopsy, if a person doesn't know, they will not say. Something like one only sees what one knows. So depending on the individual optical memory, it is based. But here in this one, Virtopsy, different it can be sent to different experts who can give their opinion. Okay, so there is also archiving. So whenever it is required, they can go back and look at the storage database, and then they can come up with the findings in case if it is required. So the limitation of reporting of the findings, even the language by which the traditional autopsy is being done and how images are actually explained, so that it gives a mental picture in the mind. The exact things are also lost to time, some of it. So in the things of the mind, you will want the things you know. So that is one disadvantage regarding subjective interpretation of autopsy finding. So Virtopsy, it mainly focuses on 5 forensically relevant topics. First is ultram mortis, that is a pathological reconstruction and explanation of the cause of death. Secondly, relevant forensic pathomorphologic findings. Third is the vital reactions, reconstruction, injuries, recapitulation, and visualization. So what are the advantages of having a Virtopsy? Virtopsy gives observer independent and objective data archiving. It is non-destructive and is minimally invasive to the body. It provides actual size documentation and is three-dimensional and provides 3D geometry that is correct in X, Y, Z axis or is space documented, and is not necessary to touch forensic evidence and is not destructive of forensic evidence. The real data-based reconstruction with sound scientific basis is actually seen in Virtopsy, and it provides an alternative also or as additional examination tool for difficult body area of autopsy like the face, the neck, and the pelvic region, the inner side. So it can be done as a double bookkeeping, traditional as well as Virtopsy, and then it can be compared, or it can be used as a completely an alternative also. So could be used in cultures and situations where autopsy is not tolerated by religion or rejected by family members. Example, psychological reasons, and provides ability to examine bodies contaminated by infection. Sometimes there is a situation which has epidemic proportion or pandemic proportion. The bodies can be examined by Virtopsy if there is toxic substances or other biohazard, or in case of bioterrorism, contaminated body can be examined. So it provides two-dimensional as well as three-dimensional processing for presenting, visualizing the findings by people not present during the examination. So it can be shown to people, those who have not attended the autopsy or Virtopsy, and it gives a greater understandability in the court. If we are able to show them in the court, it gives them a greater understandability, and it supports the process of quality improvement by digital archiving, and it's also good for database for teaching, learning, and education. And especially the best one is teleradiopathology and teleforensics for second opinion. So what is the disadvantages of Virtopsy? There are 3 main disadvantages of Virtopsy, including those that we might encounter as the process even develops further. First is the cost. Cost factor, there are many machines which are being used, so cost factor is going to increase only. So limited tissue resolution, that actually depends upon the type of scanner that is being used. Right now we have 64 slice this and the capacity, and then it can increase. Okay, so no visualization, and other one is no visualization of organ color, that is inflammation process. That means only the surface scanner, by the help of surface scanner we can find out the exact color of the body, but the internal organs, the color visualization has not been developed so far. That is also a progress that needs to be done in the Virtopsy technology. How is the workflow? As we have seen already in the video, there is a photogrammetric 3D optical scanning. After that, there is a computed tomography to see any bone injuries or gross pathologies, and after that, magnetic resonance imaging (MR). And after that, if required, conventional invasive autopsy also is being done, and after that, all the findings are compared. So here we can see the equipment of photogrammetric documentation. Okay. So there are different, these markers are being kept, and different angles from where the photos will be taken in both x-axis, y-axis, and z-axis. The images for a photogrammetric documentation of the body is prepared with coded markers. These are the coded markers, these are the crosses, coded markers. And then after that, non-coded adhesive circular markers that are present in the body, and they are pasted in the body, and then there are 2 coded scale bars present. Okay, and after that the photos are taken. So here you can see different photos are being taken, and these are the green areas which actually are the reference points. Okay, and these are the position of the camera, and then after that there is a scale bar. Okay, so scale bar is also there. From there we can exactly pinpoint and reconstruct an image. Okay, so here we can see this is the scanner. Okay, we can see 3D documentation of external injuries or injuries of the deceased with high resolution surface scanner performed on CT table. The fringe pattern, you can see these fringe patterns, okay, are projected over the body surface with white light projections, and 2 camera records these fringes. Within seconds, the software will calculate the high precision 3D coordinates and up to 4 million object points per measurement. So that is a very high precision equipment. And here you can see at first the markers, and then after that all the photos from different angles being reconstructed, and we have the whole picture. In CT, this one was the first time when the CT was used, was in 1972 for anatomic slice, single anatomic slice with scanning. Here you can see in the B photograph, okay, the fast scanning of the body organs, high resolution and enabling CT angiography of the complete craniocervical region. So you can see the voxel and the pixel, okay, in different directions. This is how the CT scan was done. So this is a typical CT scan setup. You can see the CT scan room. The big gantry is here with a typical tilted at 30 degrees. Contains X-ray components and measuring in system. You see how the X-ray tube is there. This is the gantry opening, field of measurements, as well as there is an anti-scatter collimator, and detector array is there. This is the lateral view of the same. Okay, so we have got a rotating system which typically covers the field of measurement up to 50 centimeter diameter. So here you can see the spiral CT, the direction of the patient or the disease, and the start of the CT spiral, and then after that the path of the rotating X-ray tube and the detector. This one is in case of standard in a standard mode on modern CT scan. Okay, where there is moving body parts, but since we are using the cadaver or the dead body, so not many moving parts will be there in the without outside the body. Inside the body there won't be any moving parts. So there is a fan beam and cone beam, different type of this 64 slice scanning, okay, for faster and faster scanning. Okay, as well as from single slice to multi-slice acquisitions. These are the 2 types. One is micro CT. If we have got a small evidence that we have to do X-ray studies or scanning, then that can be done using this micro CT. It's usually used in case of animal studies and mummies also, and other archaeological findings. Here we have got this rotating gantry. They work on CT technology. Here we have got this postmodern changes in the brain up to 18 days. It is a brain tissue of a sheep. Okay, so we have got here, this is the region of interest. Okay, this region of interest, and the gas bubbles starts coming up, and then region of interest starts differing, okay, changing. So we can say the postmortem interval from this technique. Here we have got multi-slice CT view of blood aspiration of in the lungs, and then here we have got MRI image of the blood aspiration. So this is actually the blood aspiration at autopsy, how it is seen in the autopsy table. And here we have got the aspiration in multi-slice computed tomography, okay, of the same finding. So we can see that different type of examination of the dead body can be done using Virtopsy. So we will see one incident specific case of trauma. Different cases are there. We will be discussing in short trauma. Here we have got autopsy photograph, the upper one. On top, in three-dimensional multi-slice computed tomography, surface reconstruction of a 15-year-old male who committed suicide by ramming a kitchen knife into his chest. The stab wound is clearly visible with an arrow, the yellow arrow here. This is 3D multi-slice computed tomography with surface reconstructions. So here we have the upper one, the autopsy photograph, and below one is a multi-slice computed tomography surface reconstruction 3-dimension showing a suicide stab wound with the arrow of one elderly male. You can see here the chest of a female victim of a homicidal stabbing. The closely grouped and predominantly uniform wounds on the autopsy on the top and multi-slice computed tomography with surface reconstruction at the bottom. It has awoken some suspicion that it might not be homicide, but it is suicide. So, however, the crime scene examination was done and they have ruled out the possibility of suicide, but in the case of a homicide. So here we can see the multi-slice computed tomography of sagittal reconstruction of a thoracic case. There is a clear, these yellow dotted lines, dash line. You can see the boundaries, okay, and then it is up to immediate through the chest up to immediate vicinity of the heart. So here you can see a small image in an autopsy photo of the open rib cage with a probe demonstrating the wound channel. So this is multi-slice computed tomography 3D bone reconstruction front view. The image only has large lesions as evident as the computer automatically smoothens the finer structures, thus obliterating some hairline fractures. However, there is a fracture of the third rib. 1, 2, 3, third rib fracture is there with this red arrow, and then we can see this groove, yellow groove, due to a stab injury. Okay, third, fourth clearly depicts. Here you can see the lateral view of the same. In this image, the osseous lesions depicted in the figure are seen in the lateral angle, okay, facilitating geometric assessment of the stab injury. So this is the photograph of the clean rib case after the autopsy being done and compared. The groove and the fractures on the radiological images could be confirmed. So whatever we could find out, the small stab injury here in the rib was already shown in the 3D reconstruction CT. And likewise, here we can see this is a magnetic resonance imaging T2 weighted sagittal MR of the chest, MRI of the chest. The left ventricle display a lesion with yellow in the pericardial sac, and the thoracic case with single this one cell rich layer, okay, and in this area, and the cell poor layer in these regions. Here we can see the T2 weighted images of MRI chest. Here in the left thoracic case, you can see one single X corresponding to cell poor blood components, and the signal poor double X area which is depicted. This is full of blood cells. And here we have got one inserted autopsy photograph which demonstrates the left-sided hemothorax with a coagulated blood. So here this is one interesting case of a 30-year-old man who was stabbed twice by his girlfriend during a scuffle, and he collapsed after several minutes. The lady was claiming that she was trying to defend herself and ward him off, and she was just holding a knife. And the boy, the 30-year-old man, he actually plunged into the knife. Okay, so that was the history. So we can see here there are two stab injuries here. The autopsy photograph depicting the brachial artery and corresponding veins which was injured. The blood vessels and the injuries led to death by exsanguination, that is loss of blood. Okay, exsanguination. So we have got here is multi-slice computed tomography reconstruction of the right shoulder. You can note that the wound channel here, yellow arrow of the stab to the chest, did not reach the pleural cavity. Okay, it has not reached the pleural cavity also. So the The other one is the multi-slice computer tomography axial reconstruction of the right shoulder. Note that the stab wound on the chest is here, green, and to the arm is in the yellow. This is the chest, this is the arm. The pleural cavity is intact. Okay, so here the multi-slice computer tomography reconstruction. Note there is a large hemothorax on the back. Okay, this is another case. There is a stab injury in the front of the chest on the right side. Okay. The total distance from this one, the front and the back to the chest also can be seen with this dotted line. It's around 150 millimeter. Even the distances measurements also can be done. We have here, what we have below here is a 3D reconstruction of a clinical postmortem data of a victim, okay, of a homicidal stabbing on the head. You can see here homicidal stabbing on the head and trunk also. The two osseous lesions you can see here, green, red, and the blue ones. And the yellow are the clippings of surgical clippings. These are the fracture areas, stab areas, where you can see it clearly. This person was stabbed over the chest as well as on the head. This belongs to the same person. So here we have got postmortem multi-slice computer tomography coronal image of the head of the victim. The stab channel is clearly demarcated by these yellow lines, and the blood within the ventricular cavity, here you can see, is by this asterisk within the ventricular cavity. Note that the skull defect is there due to craniotomy. This is the skull defect. Craniotomy was done. That is a surgical neurosurgical procedure, and there is a brain which is bulging out, and there is a midline shift here clearly. You can see there is an increase in the intracranial pressure, as well as there is a lethal cerebral edema. Okay, so here you can see these are also the craniotomy wounds. This is also craniotomy wounds. All these things can be seen. Here we can see the postmortem multi-slice computer tomography, three-dimensional description of the head of the victim. The skull cap has been virtually removed in order to show the osteoclastic defect. This is the osteoclastic defect, and the stab channel demarcated by yellow dotted lines. The stab injury on the chest. You can see multi-slice computed tomography. There is a contrast agent that is used here. The stab is there in the chest as well as the abdominal wall. But on the abdominal wall, you can see these red arrows. It's clearly depicting. And here you can see there is a cyst in the kidney. Okay, the kidney, left side of the kidney. Okay. So as we have already seen the different types of injuries which have been done, incident specific cases in sharp homicide done by sharp weapons, okay, or suicide also. So I want to talk regarding the Indian scenario. What is the scenario of Virtopsy in India? This is the cutting of Indian Express news. The news which was there in 4 December 2019. The ICMR and the All India Institute of Medical Sciences, they have come up with this project, and health minister, the then health minister Harshvardhan, Dr. Harshvardhan, in Rajya Sabha stated that India will be the first country in the Southeast Asian region where virtual autopsy will be done. So as with the ICMR and AIMS have studied this global practice and taken up this project for dignified management of the dead body. This is the exact word, dignified management of the dead body, and as well as adding that the family members of the deceased feel uncomfortable with the traditional way of postmortem, as Dr. Harshvardhan has stated. And the minister also said that all records will be digitally stored for review. He said the virtual autopsy will be cost and time effective, as it would take only 30 minutes to complete one autopsy as compared to 2.5 hours taken by conventional postmortem. The new technique will facilitate and ensure that there is no delay. So as it can be government funded, and it is funded in AIMS New Delhi as well as with ICMR projects, then the cost can be greatly reduced for the common public, and time effective as well as storage. So this was passed in the Rajya Sabha. He actually gave this in his speech in the Rajya Sabha on 4 December 2019. So they have been instructed to start within 6 months, Virtopsy in AIMS, New Delhi, and after that, rest of the country will be trained based on the in lines with the AIMS New Delhi. They have requested the people from this University of Bern in Switzerland. So this is the file photo of AIMS New Delhi. So recently, in the 25th January 2021, as per Indian Express, the college SCB Medical College in Odisha have proposed the government to adopt virtual autopsy. The method involves conducting autopsy by scanning and the organs, bones, and tissues, etc. And recently, only like a month before, Nigrim Shillong also has started the project, and amount around 4 crores has been sanctioned for starting this Virtopsy technology in our Northeast in college, the Northeast Regional Institute of Northeast Indira Gandhi Institute of Health and Medical Sciences, Nigrim Shillong. So, in conclusion, I would like to say the importance of the use of non-invasive techniques, in particular Virtopsy, is immense. The consequences extend far beyond the ability of such techniques to identify particular medical findings. As the technology and knowledge of autopsy increases, the social and legal consequences will of course also increase. So even present technology has had some effect, and if better understood by the courts and police, its benefit would be very significant. So these are my references, and most of the findings has been taken from the book written by Michael Thali, professor, and Richard Dinhofer and Wok P, professor, in the University of Bern in Switzerland. And these are the references. Thank you. Thank you very much.
Thank you, Dev sir, Dr. Dev sir, for this presentation. So we'll be looking for any Q&A in the seminar. So some of our sirs and madams have asked what are the possible disadvantages of virtual virtuopsies, and someone has asked is virtuopsy logistically possible in Indian scenario. So sir, would you like to take up the questions? And after that,
okay. Thank you very much for the question. The possible disadvantages, as we have already discussed in the slides, that there are mainly 3. First is the cost. If it is government subsidized, it is going to decrease. And then other one is, if there is increase in the technology as well as competition, that also can decrease the price factor, cost factor. And virtuopsy is possible in Indian scenario, as it has already been passed in the Rajya Sabha and it has been declared by the then Health Minister, Union Health Minister Shri Harshvardhan ji, in December 2019, and it has already been established as a project in AIMS. They have started doing it, and even in SCB Medical College in Odisha, they have started this project. For starting the project, they have asked permission from the government, as well as in our own Northeast, in the Negrims in Shillong. They have started with a huge budget of 4 crores initially to establish a virtual autopsy center, regional center. Thank you very much for the question and time. Now I would like to conclude the session. Thank you very much. Have a nice day.